Welcome to SLP Nerdcast. I'm Kate.
And I'm Amy, and we appreciate you tuning in. In our podcast, we will review and provide commentary on resources, literature, and we'll discuss issues related to the field of speech-language pathology.
You could use this podcast for ASHA CEUs. For more information about us and certification maintenance hours or CEUs, go to our website, www.slpnerdcast.com. SLP Nerdcast is brought to you in part by listeners like you. You can support our work by going to our website or social media pages and contributing. You can also find permanent products, notes, and other handouts, including a handout for this episode. Some items are free, others are not, but everything is always affordable. Contact us anytime on Facebook, Instagram, or at info@slpnerdcast.com. We love hearing from our listeners, and we can't wait to learn what you have to teach us.
And just a quick disclaimer, the contents of this episode are not meant to replace clinical advice. SLP Nerdcast, its hosts and guests do not represent or endorse specific products or procedures mentioned during our episodes unless otherwise stated. We are not PhDs, but we do research our material. We do our best to provide a thorough review and fair representation of each topic that we tackle. That being said, it's always likely that there is an article that we've missed or another perspective that we haven't shared. If you have something you'd like to add to the conversation, please email us. We'd love to hear from you.
So, Amy, what are we talking about today?
Today, we are talking about the collaborative practices of BCBAs and behaviorally oriented professionals.
We are. So we tackled this topic in a previous episode. And in that previous episode, the title of the episode was called Collaborating with BCBAs. And the focus of that episode was obviously collaborating with BCBAs, but through the lens of the speech pathologist. So what are the attitudes and practices of speech and language pathologists, and what are some strategies to help speech and language pathologists collaborate effectively with behaviorally oriented professionals? And we say behaviorally oriented professionals because most of us working in the field know that they come by varied names. So you can have board certified behavior analysts, you can have RBTs, which are registered behavioral technicians. In some places, they still use an old-fashioned term, ABA therapist, which is usually a paraprofessional level person, even though they use the word therapist, which is confusing. You can have psychologists who are behavioral psychologists. So a behavioral-oriented professional can go by many names. And I think it's really important to talk about this because the relationship between SLPs and behaviorally oriented professionals is really, really strained. And we are going to talk a lot about that today. And before we get into it, I think what I would like to do is read the learning objectives, unless you have anything to add.
No, I think that that's a great place to move. Let's move on to the learning objectives.
To the learning objectives.
Okay.
So learning objective number 1, discuss the importance of collaborative practices that are not unidirectional. Learning objective number 2, identify at least 2 functional differences between field structures, job roles, and responsibilities of SLPs and BCBAs in school environments. And learning objective number 3, identify at least 2 differences in the evolution of the fields of speech and language pathology and applied behavior analysis that serve as barriers to collaboration.
And I mean, part of this came out of when we were researching for the previous podcast, you found this article.
Yes. So in a previous episode on integrating AAC into behavioral programming, I found an article that gave me all the happy feelings and made me
danced. You waved your hands in the air.
I pumped my fists in the air. I read the whole thing with a highlighter. And if anybody listens to this podcast, they know that I am the working clinician that skips to the end and reads the discussion and the results to figure out what is clinically applicable to me, but not this one. I really took this one and I made love to it in my mind because it was so good. And then I emailed the author, and turns out he's a super nice fellow, and he emailed me back and we had a nice exchange. And then he agreed to come on to this episode to talk about his work. And just quickly, I think it's worth noting that this article actually had 2 authors. So the first author was Amy Kelly, and Dr. Tincani was the second author. And he informed us that this was her master's thesis or her graduate dissertation. And unfortunately, we could not get a hold of her. The journal where it was published directed us to Dr. Tinkani. So he was the one who agreed to come on and have a conversation with us. But giving credit where it's due, Amy, if you're out there, we loved this article so much. And thank you so much for writing it. It really was spectacular. So this episode is sort of a two-parter. We are going to talk a little bit about the background and history of our two fields. And then we are going to talk about this specific article, why it's important, and some of the big takeaways of this article. And then we had the pleasure of welcoming the author, Dr. Matt Tinkani from Temple University. Or I guess we should say just one of the authors, since the first author, Amy Kelly, was not available and we couldn't get a hold of her. We had the honor of welcoming him onto our show and having a really great conversation with him about this work and about the collaboration and collaborative practices between these two fields, mostly and also related to the field of special education and education in general. So I guess without further ado, we need to get our financial and non-financial disclosures out of the way also, just sort of taking away some of these housekeeping things.
Very exciting stuff.
Well,
Kate, take it away.
Really, really fast. Financial disclosures. Kate, that's me, is the owner and founder of Grand Bois Therapy and Consulting, LLC, and co-founder of SLP Nerdcast. Amy is an employee of a public school system and co-founder of SLP Nerdcast. Non-financial, Amy and I are both members of ASHA SIG 12. We both serve on the AAC advisory group for Massachusetts Advocates for Children. I'm a member of the Berkshire Association for Behavior Analysis and Therapy, Mass ABA, the Association for Behavior Analysis International, and the corresponding Speech Pathology and Applied Behavior Analysis Special Interest Group. Dr. Matt Tinkani's financial disclosures. He's a professor at Temple University within the College of Education and Human Development, working within the departments of Special Education and Applied Behavior Analysis. He's also the chairperson of the Department of Teaching and Learning. Non-financial disclosures. Dr. Tinkani is a board-certified behavior analyst, doctoral level. So let's talk a little bit before we sort of dive right into our learning objectives. So for our listeners who are regular listeners, we usually go through our learning objectives in a sequential order. This episode is a little bit different. We are going to address our learning objectives sort of here and there. And in telling the story of why this article was so important and why we felt the need to sort of open this can of worms is because, like I had mentioned, the relationship between behaviorally oriented professionals, particularly the relationship between ABA and speech and language pathology, is incredibly strained. I have experienced this firsthand. Amy has experienced this firsthand. I see insane things posted on the internet about this very difficult and collaborative relationship. If anything, and I know I've said this on an episode before, I was motivated. So I'm a duly certified speech pathologist and board certified and BCBA. Amy did all of the coursework and clinical placements and then just didn't take the exam. I was motivated to get my BCBA, and I have said this before, to infiltrate the enemy camp and dismantle it from the inside. I was so tired of having horrible interactions with BCBAs, leaving conversations feeling really frustrated. I just kept thinking to myself, what do these people know that I don't know? What is this training that they get? Why are we having these really difficult discussions? And the purpose of this, and I could go on a soapbox about my own experience for a long time, but the purpose of this episode is to sort of unpack a small component of that strained relationship. And I think it's important for our listeners to understand that I have personally experienced that strained relationship, particularly in having a difficult conversation with a behaviorally oriented professional and feeling like there are not a lot of collaborative skills on the table. And we are going to unpack that a lot more. So why is the relationship so strained? So the analogy that I use with this is that sort of like a bad relationship, like a bad friendship,
like personal relationship that's just gone awry.
Right. So when you have had, if you've ever had a friend who's had a really bad relationship and you say, why are you with this guy? And they say, well, it's complicated, right? There's like all these layers and layers and layers. And it's a combination of a lot of things. It's a history. So these two fields have been fighting for a long time. not fighting, but there's been a strained relationship there for a long time. There are a lot of people out there who have had really bad personal experiences, and we have an overlapping scope of practice with this field, whether we like it or not.
Well, and I think just to think about some of the things that you said for a second, a lot of people have had bad personal experiences, and it makes me think about reviews online, right? When you have a really bad experience, that sticks with you in a way that moderately decent experiences or even like somewhat positive experiences don't. I feel like we're programmed to focus on the negative. So those, for me anyway, those things carry a lot more weight. Even thinking about like if you've ever had food poisoning or anything like that that's been a strong experience, a strong negative experience, you're reluctant to eat from that same place or perhaps even have food in that same flavor profile ever again because your experience was just so bad. And I think some of us have had the emotional equivalent of food poisoning.
I still have it. And I'm a BCBA, and I have conversations with other BCBAs where I'm like, oh God, this is just a disaster. So it does happen. It happens to all of us. And if you are out there and you've never had this experience, that's awesome. Because
that is awesome.
One of the things that we're not going to talk about a ton, but the field is changing. I've been to a lot of ABA related conferences over the last couple of years where this topic is a focus, and there is a wave of change coming with people who are being trained in behavior analysis today, which is awesome. But
so if you've had emotional food poisoning, come back, try again.
Emotional food poisoning. That's so good. So yeah. So let's get into this a little bit, because I think part of it have to do with the way we were trained. And by we, I mean speech pathologists at large. And part of that is history. So in the 1960s, there was a tiff between B.F. Skinner at Harvard and Noam Chomsky at MIT. That's how far back this goes, 1960. And we're not going to get into their tiff, but they exchanged some pieces of academic literature. They reviewed each other's stuff. It was a little public, and the division begins. So the division has been there for a long time, and history is definitely a piece of that. And on top of that strained history, the field of ABA is relatively young. So the first master's program for ABA wasn't established until 1994. And the BAC
not that long ago.
Not that long ago. And the BACB, which is the Behavior Analysis Certification Board, which is basically ASHA for ABA, wasn't established until 1998. I could drive them. It's not, and I'm not that old. So it hasn't been around for very long. There's an article we found that lays out the history of ABA pretty nicely, and it's on our website. It's the Johnson et al. Article published in 2017. The first BACB exam where they get their, so sort of like our praxis.
The praxis, yeah.
Right. Wasn't conducted until 2000. And a lot of states across the country today in December 2020, they still don't have licensure at the state level. In 2017, at the time of that Johnson article was published, only 27 states had passed ABA licensure. So in general, the field of ABA has had a lot of growing pains in the last 20 years because they're basically a teenager. The field hasn't grown into itself yet. And if you compare them, so if you compare this to the history of speech pathology, ASHA was established in 1925.
I could not drive then.
Right. Neither could my great grandmother. So, if you go by the birthday of credentialing bodies, the field of speech and language pathology is 73 years older than the field of applied behavior analysis. Now, ASHA was established in 1925 under a different name. It morphed, it changed. I don't think that it was called the American Speech and Hearing Association until the 50s or 60s or something. Don't anybody quote me. I don't have a reference for that, but you get the picture. ABA is a young field. They have had a lot of growing pains in the last 20 years. And the BCBA that you argued with in 2006 or 2009 or 2012 is not necessarily the same education and BCBA that you are going to meet in 2020 and beyond. It's 50 years of difference. It's a big deal.
And the BCBA who you perhaps argued with wasn't a BCBA. They could have been a behavioral professional, which may have meant
right.
Who knows what?
That's another great point. So in all those states across the country where they don't have licensure, when one of my first jobs, there was a guy working there who was a behaviorist. That was his title. And he
Yeah,
walked around and he prescribed behavioral interventions. I found out later he had a bachelor's degree. He had no professional training, but that was his title. So if you had emotional food poisoning by a behaviorally oriented professional, which is just such a great term, it might not have even been a BCBA. It might not have even been an ABA oriented professional because, and this is part of the growing pains of the field, right? In the field of ABA being so young. So I want to use another analogy here about this really complicated layer. And Amy's laughing at me because I'm so obsessed with this analogy. I wrote it and I was like, oh, I love explaining it this way. She's laughing at me. So the strained relationship between these two fields is really big and it's really complex and it has a lot of layers like an onion.
Like an onion.
It's like an onion. All right. It's layer on layer of really fragile stuff that might make you cry if you've had a bad day. And we want to unpack. The purpose of this episode is not necessarily is to sort of set the stage and peel back just one layer of the onion, which is the collaborative practices and attitudes of the behavior of the board certified behavior analyst or the behaviorally oriented professional. We're going to have to, a lot of us listening to this could have some uncomfortable feelings as we go through this, and that is totally okay. We have all had those uncomfortable feelings, myself included. Sometimes I have angry feelings. That's okay too. But we have to get through those angry feelings to make it work. And at the end of the day, we're ethically obligated to go through those feelings and try and make this work, period, because that is how the behaviorally oriented professional is often a primary or major stakeholder for our client. And we're ethically obligated to have those collaborative and professional relationships. So in terms of the layer of the onion that we're going to pull back, these collaborative practices, I think we need to take a second before we get into Dr. Tincani's article. I want to look at the kind of training. I think it's important to look at the level or to even ask the question, what are the training and collaborative practices that the two fields bring to the table? Now, I did not have a graduate level course in collaboration. Did you?
No, I didn't have a graduate course called collaboration. I do think that we talked a lot about it.
Right. And I think one of the things that sets our two fields apart is that speech pathologists are trained for direct service. So we are trained to sit in the chair with the client or be in the hospital on the floor or do bedside evaluations or whatever. All you medical SLPs out there, like hats off to you. I don't know what your terminology is because I've never worked in that setting, but we are trained to be direct to provide direct service. And the behaviorally oriented professional, particularly BCBAs, more often than not graduate and take on consultative roles because they can bill for indirect service. They provide much higher volume of hours than we do. And one of the things that's really important about indirect service often turns into a collaborative intervention strategy. You have to use collaborative skills and collaborate in order to provide effective indirect service, which is really, really important, right? So imagine if we had funding for indirect service, how often we would be talking to parents outside of the treatment room, calling schools or calling outpatient clinics or calling other disciplines to collect information and do some of that collaborative work. That is the primary role of a lot of BCBA's jobs, is this indirect service. And I got to tell you, if we could get funding for indirect service, I'm not going to get on a soapbox, but that's super, super, super important.
I would like to get on the soapbox just briefly and say, as somebody who works in a predominantly consultative role in my current place of employment, I really feel like this is an area where speech language pathologists as a whole really need to do some advocacy around billing and our ability to be able to support our clients through indirect service, which is such a meaningful service delivery model.
And if you don't believe us, listen to every single episode we've ever published across almost every single topic, evaluations, counseling, swallow, every single topic that we tackle, there is a room for indirect service. It is not just for behaviorally oriented professionals. It's our entire field.
Right.
But in terms of that collaborative relationship and how we approach that collaborative relationship, so speech pathologists, we get trained as direct service clinicians. board certified behavior analysts graduate and often step into a consultative role, which is hinged on effective collaborative practices. So it seems like having good collaboration skills would be super important for the BCBA. And we were lucky enough to find this incredible article by Amy Kelly and Dr. Tinkani. Dr. Tinkani, if you're listening, hello, thank you for coming on to our show. It addresses this exact point. What are the collaborative practices and attitudes of behaviorally oriented professionals? Okay, so the actual title of this article is Collaborative Training and Practice Among Applied Behavior Analysts Who Support Individuals with Autism Spectrum Disorders. And it was written by Amy Kelly and Matt Tinkani. It's an older article, so I think we all need to keep that in mind when we go through the results and the data. But when I read it in 2020, we wanted to review it because we felt that there were components of this that still held in terms of what we see as boots on the ground as clinicians.
And I think another piece that we had talked about when reading this was that, I'll overuse the emotional food poisoning, but, it's possible that
You
people
can't
have
overuse
had
emotional food poisoning. I'm going to be using that until I'm 90. Continue.
It's pretty good. Okay. So it's possible that, you've had a bad experience that was, 10 or 12 years ago, and it still sits with you.
Mm-hmm.
It still sits with you. And so I think it's helpful, to reflect on what you've been saying, Kate, about the evolution of the field and how it is a young field and it's moving in the right direction, but that doesn't invalidate people's experiences that they had previously. Those experiences are also still real.
Mm-hmm.
You experience that bad interaction, and I think it can be helpful. One thing that I liked about this article is it can be helpful just to go through and have some data to, anchor your emotional experience onto.
I totally agree. And, I think sort of jumping off from there, I want to take like one quick second and just think about why is this important? So why do we care? Why do we care as speech pathologists what the practicing attitudes about collaboration are from BCBAs? And I have a citation for that. So
Bring it on.
It is critical for us to understand the scope of practice and training of members of other disciplines in order to effectively collaborate. And that that is everything from areas of expertise, education and training, scopes of practice. Because if you don't have those fundamental understandings of another profession, then you are not going to be able to come to common ground. You're not going to be able to have effective problem solving discussions, and you're not going to be able to rationalize the expertise that the other discipline is bringing to the table. So real collaboration really can't happen without those fundamental understandings. And again, going back to that tense relationship, there is so much misinformation out there about the scope and practice and training and background of applied behavior analysis that I think unless you truly understand the training and attitudes of the other professional, you really can't effectively collaborate. And I should say that I pulled that gem of wisdom from an article that was not me. That came from an article that I definitely want to reference. It's on our website for readers to learn more. It's a really incredible article written by LaFrance, Weiss, Kazemi, Garanzer, and Dobre. So moving along quickly, we're sort of burning time here into this article by Amy Kelly and Matt Tinkani. So we hear a lot of conversations from our colleagues about how conversations with BCBAs can sort of sometimes feel like my way or the highway. And I have had that experience personally. And I think the reason why this article spoke so deeply to me was because the data validated that experience a little bit. So before we get into that, I also want to make a disclaimer that we're not PhDs or statisticians. I know we read that in our disclaimer at the beginning of the episodes. We do encourage everyone listening to read this article for themselves. What we're going to do is take you through the methods and results of the published work for the sake of the discussion that we have with Dr. Tinkani at the end of the episode. If you have any questions about this work, Dr. Tinkani was super generous and offered his contact information. So we definitely encourage you to contact the author. You can also email us with questions too if you want. But as a disclaimer, we are not statisticians or PhDs in terms of analyzing the.
I would say, right, we're not here to critique the actual experiment itself. What we are here to do is share our emotional reaction to it and give you enough details so that you're informed when we ask Dr. Tinkani all these questions about his research later on.
See, you said that so much better than me. All right, so into the research. So they recruited behaviorally oriented professionals through the special interest group of through different special interest groups of the Association for Behavior Analysis International, otherwise known as ABAI, which is another governing body.
ASHA-ish.
It's ASHA-ish. And they recruited participants that either held a certificate or license related to the field of ABA or education or human services and had direct contact with consumers in the field of ABA in their work setting. So these weren't necessarily BCBAs, but they had a certificate or license related to that field or were in education and were members of an applied behavior analysis special interest group. So these were, as we have been saying continuously throughout this episode, behaviorally oriented professionals. Their recruiting resulted in 302 participants, over half of which were actual board certified behavior analysts, BCBAs, and the rest were different professionals, special educators, regular educators, psychologists, etc. And they came from 20 states representing the Northeast, Mid-Atlantic, Southeast, Midwest, Southwest, and Northwest regions of the U.S. The participants were sent a survey, and the survey collected data on a variety of different things. And I'm going to list what the survey looked at. It collected demographic information, their current collaborative behavior across 12 different disciplines. So this is really where it gets interesting. So the survey didn't just look at their collaborative behavior in general, but specifically looked at how they collaborate with 12 other disciplines, 12 other different types of professionals, including.
Were we in there? SLPs?
Yes. Oh yeah, we're in there. So it looked at collaborative behavior with other BCBAs, other board certified behavior analyst assistants. So it's sort of like the SLPA equivalent, non-certified behavior analysts, psychologists, school psychologists, general education teachers, special education teachers, OTs, PTs, speech pathologists, administrators, healthcare providers. And I think that was it. So what looked at their behaviors across those different professionals, and across those different professionals, it looked at how often they collaborated, what modes they used for collaboration, i.e. over the phone or in person, what professionals did they collaborate with most often, how likely they were to give behavioral recommendations to those professionals, and how likely they were to integrate behavioral recommendations from those professionals.
And I think, with any survey, because it was a survey, this is giving us really interesting information, but it's also what the people who are responding are reporting. So when we, look at the results from this, we don't know exactly, the accuracy that they're reporting.
It's survey data, which is not, we're not looking at causal variables here. These are individuals self-reporting their attitudes through a survey. And I think that's really important to keep in mind. They also looked at, so think of a matrix here, right? We have a list of all of these different professionals and all of these different attitudes about their own behavior across in terms of interacting with all these professionals. The survey also looked at what variables they thought inhibited them from collaborating and what variables they felt facilitated collaboration. It looked at the ideology of their own practice and the ideology of the other professional, their own training, the training of the other professional, their own perspectives, other contingencies in the environment, and time. So across those items, which ones inhibited collaboration and which ones facilitated collaboration?
Which I think is an interesting thing just to reflect on in general as a professional who collaborates with other people. It's interesting to just think about those factors and how much weight they might have for you. So that's also just an interesting thing that you get out of the article and just thinking about those variables.
Yeah, definitely. So then the final thing that the survey collected was the practicing behavioral professional, what their perspectives were on collaboration in general. So what were their own perspectives on collaborative behavior? So they were asked to rate the importance of collaboration, what their experiences were with collaboration, and how much they valued collaboration with those 12 different disciplines. Or I didn't say how much they valued, but what was the value of collaborating with those 12 different disciplines. So the definition of collaboration through the course of the article was the following. I'm going to read it. It's a quote from page 124. A component of consultation involving voluntary interpersonal interactions, comparison of two or more professionals engaging in communication modalities for the purposes of shared decision-making and problem solving towards a common goal. So that's a pretty thorough definition of collaboration in my uninformed estimation. my layperson speech pathology brain. So they collected all of his data using that definition of collaboration across all of these different variables and about collaborative practices and attitudes. And the results were really, really interesting. Again, disclaimer, not PhDs. We are just going to make some commentary we're not making commentary on the quality of the research. So the results. The participants reported that they collaborated on a regular basis. So 23% reported collaborating on a weekly basis. 10% reported collaborating on a biweekly basis. So that's a decent amount. That's more collaboration, I think, than most speech pathologists get in a work setting where they might be doing just direct service.
Agreed.
The results indicated that participants reported mostly using face-to-face as a modality, but also by email. And I think that that's something that has definitely changed over time. I mean, here we are in COVID, nobody's doing anything without a Zoom account. So,
right.
This is, keep in mind, this article is 10 years old, but this is where it starts to get interesting, where I started fist pumping in the air. Data indicated that professionals were more likely to give behavioral recommendations to professionals than to accept recommendations from professionals, with one important exception. Participants reported that they were more likely to accept the recommendation of another BCBA. Participants were more likely to implement recommendations by other BCBAs. And I think that that is a very important takeaway. That's 10 years old, almost, to be fair, in a very young field. But this was the part of the data where I felt, oh my gosh, this is the conversation that I have had so many times that feels like my way or the highway.
Well, and I remember the conversations that we had back in the day when we were doing the coursework together. And I think that was something I feel like we had conversations about, the motivation to get the letters so you could whip them out like a sword.
Exactly.
And be like, I have them too.
And I think I probably used some unclean language when I made that description. I know exactly what you're talking about. But yes, I think that this is a real thing that I have experienced. And what's even more interesting is that the article breaks down the data by different disciplines. And the most pronounced gap was between the behaviorally oriented professionals, the participants, and special education teachers. SLP recommendations, believe it or not, were not in the lowest categories. So PTs, OTs, general education, and healthcare providers were less likely to was reported that their recommendations were less likely to be adopted than the SLP recommendations. And in terms of looking at the other components of the survey, like the data for barriers to collaboration. So participants were asked what ideologies, what was it time restrictions, ideologies, training on the part of themselves, training on the part of the other collaborator, what were the barriers between collaborations and other professionals. And participants were more likely to identify that the inhibitors, the barriers were on the part of the other professional, not on the part of themselves. They identified very easily barriers for others, but not for themselves. And I think that is also, again, 10 years old, really new field, but something that I have experienced, and I think a lot of our colleagues have experienced in terms of trying to effectively move through a problem-solving conversation or a collaborative relationship.
And I think that, it's a survey. It was a survey that was conducted a while ago. And I think that one of the pieces about this survey that did resonate with us is it just lends some type of acknowledgement to perhaps if you've had a less than optimal experience.
For me, my take home was, okay, I'm not making it up. These difficult conversations are a real thing, and the attitudes and practices of other BCBAs are not the attitudes and practices for myself, even though I am a BCBA. And I can't emphasize enough before we transition over to the interview with Dr. Tinkani about this research, which evolved into a really great discussion about collaboration in education and special education in general. That, many, many, many of the behaviorally oriented professionals I work with are wonderful and contribute so much to my knowledge and to my work. And Amy, I know you feel the same way.
Definitely.
We've had this difficult conversation with a handful of BCBAs, specifically asking them, even through the venue of this podcast, why is it so hard? Why have we been having all of these difficult conversations, and why is it so hard to collaborate? And we've been told that it's not really like that anymore. So, the younger generation, not necessarily younger in age, but younger in training, collaboration is being woven more into clinical experiences. It is being woven into academic tasks. It is in the ethical code to collaborate on the part of the BCBA. So I suppose before we transition into our conversation with Dr. Tinkani, the takeaway is the experiences that you're having are real. There is data to substantiate that is happening, but don't let your emotional food poisoning spoil other potentially great conversations and great collaborative experiences that you could have with other behaviorally oriented professionals.
Because I feel like on the whole, the weight has very heavily been in the positive basket. I think that there are so many wonderful things that can come from learning and collaborating with all other professionals, BCBAs included. Collaboration is best practice. Collaboration is in our code of ethics. And I think it's the dance of, interpersonal relationships and professional development for everybody who's part of that collaborative conversation. And I think that when we learn to have more effective conversations with other professionals, regardless of their job title, I think that also lends itself to having better collaborative relationships with our families and with our clients. I think that being able to engage in challenging conversations is really, really hard. And I am by no means an expert at it. I am not fantastic, at the difficult conversation, but it's something that, is important to keep working toward refining your skills, because it's something that you really need as a clinician, I think.
Agreed. And I can't even say this enough, because I have guilty and upset feelings about saying anything bad about all my wonderful ABA oriented colleagues, and even the letters after my own name. Because I think that this is this is a complex, strained relationship, and this is a one piece, but not the whole story. So I guess without further ado, we'd love to welcome or transition over to our interview, which was really, really wonderful. And again, we are so grateful that Dr. Tinkani agreed to come on to the show with us. Before we transition over, I do want to mention we used an acronym in our conversation with him, JABA, which stands for the Journal of Applied Behavior Analysis. So in that conversation, when you hear us say JABA, that's what we're referring to.
Not the Hutt.
Not Jabba the Hutt. But if you wanted to think that would be fun too.
It would be fun. Yeah.
Okay. So without further ado, welcome Dr. Tinkani. We are so excited to welcome you, Dr. Tinkani. Thank you so much for joining us.
Oh, it's my pleasure, Kate and Amy. I'm happy to be here. Glad you invited me.
Well, we're glad you said yes. Before we begin, would you like to tell us a little bit about yourself?
Sure. So my name's Matt Tinkani. I currently work for Temple University. So my job currently is as a professor, and I'm affiliated with two programs at Temple, special education and applied behavior analysis. So during my time at Temple, which has been about 12 years, my job has been kind of a combination of teaching students who are going to be BCBAs, teaching and advising students who are getting like a doctoral degree, a PhD, with a specialization in special education, and also training teachers, special education teachers. Though right now, for the last 2 years or so, I've been an administrator. I'm chairperson of the Department of Teaching and Learning there. And in that capacity, I kind of oversee, or I kind of help to oversee most of the teacher education programs at Temple. So that would include like early childhood education, middle and secondary education, career and technical education, teaching English as a second language, all those different kinds of teaching and teaching certification areas. So when you invited me, I was intrigued because I've always been interested in kind of interdisciplinary collaboration, and I very much work in an interdisciplinary environment. Aside from the things that I have to do related to like administration of like academic programs and degree programs and things like that, I'm on a daily basis working with folks who are students who are going to be early childhood education teachers, and of course they're working with students with disabilities, but they're not necessarily going to do that work primarily as part of their career. So that's like what I do now. And of course I'm a behavior analyst. I've been a BCBA now for 20 years. And I've actually I feel when I say stuff like this, I feel old, like it just makes
You're
me
in
feel
good
old.
company.
I hear you.
Don't worry.
But
We're
I've been in
there
the field.
with you.
I've been in the field of, yeah, it was like, there was one time when I was sitting in, it was like every year we do this thing where at the beginning of the semester, we invite like all the new students in, and we kind of like do a presentation to them. And it's like college freshmen, like new students. And there was 1 year, and this was maybe 8 or 10 years ago. The person who was leading this was like, they did a PowerPoint about like all of the things that were happening the year this class was born. And one of the things that was happening the year that class was born was that a Backstreet Boys song was a hit.
Oh boy.
And I was like, I was like, okay, I'm old, like I'm officially an old person. And that was 10 years ago. So who even
You just
who
don't
even
think
knows
about
now?
it
But everybody
now.
thinks if you're like a fully fledged adult, like people, like all like the students think they're just like, you're a boomer. Like you're a boomer.
Yeah.
Like it's like no. I'm like a boomers. That's like my parents.
Our
my
parents,
parents,
right.
Older than
We're
boomers,
solid Gen X.
but like
Solid Gen X.
exactly. Like Gen X, like I'm Gen X.
Yep.
I'm Gen X. Like it's a different thing.
Very
Oh,
different.
you boomer. Like
And somehow in my
so
mind,
anyway.
I'm the age of my students or my mentees, and then they say something about like what they did over the weekend, and I'm like, oh, I really am old.
Yeah, because you think in your mind, like I feel like in my mind, I'm like, I think realistically, like to myself, I'm probably somewhere in my early 30s. Like that's like my kind of self.
Forever.
I'm 47.
Right.
I'm 47, but I'm like there,
Right.
like in my head. So anyway, yeah. So but all of this is a roundabout way of getting to the fact that I've been, when I first came into the field of ABA, when I very first came into the field, like there was no ABA as a profession. There was no BCBA. It was, I mean, there maybe was like in a couple of states, maybe Florida at that point. I don't, but I don't know the history well enough to know if the the BCBA in Florida goes back to 93, but that's when I entered the field. And, you know, I took a class and like, I was like a psychology major, and I really, you know, took a bunch of different classes, and I, did a little bit of research as like an undergraduate research assistant, and really nothing in psychology really stuck with me until I took this class called behavior modification. And we read Keith Miller's book on textbook on applied behavior analysis. And I think it's been out of print for a while at this point, but I may be wrong about that, but it was a great book. And I thought, and my professor was someone, his name's Phil Duncan. He's retired now, but like he was a behavior analyst. He went to Western Michigan and he went to University of Florida. And I was like, you know, and we read this book called Skinner for the Classroom, which was like a selection of B.F. Skinner's papers. And I was like, oh, okay. Like I get, like, I completely get this. Like I remember like the first time I saw like a single case design graph, I was like, oh, okay, I get this. This makes sense. This makes sense to me. And then Professor Duncan said, well, you know, there's an opportunity for you to actually apply the things that you're learning here, doing something called discrete trial therapy, or maybe discrete trial treatment, that, you know, they were calling it at that time. And I was like, okay, I'll do that. And I, you know, got a job being like an ABA therapist at that time, we would say a Lovaas therapist. I was doing the Lovaas therapy, which was it was sort of the loosely related to the UCLA, group at that time. And I just kind of, stuck with it since then. And, from there, I, decided to get my master's degree in ABA, and I became certified as a special education teacher. I went and I got my doctorate at Ohio State. I was fortunate enough at that time, Cooper, Heron, and Heward, Coop and Bill and Tim, they were still, they weren't retired at that point. They're very active in the field. Obviously, they just put out a new edition of their textbook, but that time they were still teaching and advising. So Tim Heron was my advisor. Finished up at Ohio State, and I went and worked at UNLV, University of Nevada, Las Vegas, for 6 years, and then the job came up at Temple for an assistant professor in special ed, and I had a great experience at Temple. I always wanted to go back, so then I went back in 2008, and I've been at Temple ever since then. So that's my
awesome.
That's my brief story.
That is
great.
awesome. I mean, I think it's really cool that you had the experience of also being going to school for special education, because I think that's, Kate is dually certified as well, and she's a speech. So like bringing that piece with the ABA complement, I think is a nice perspective to have.
And a great segue into what we're talking about today, which is this collaborative relationship between, our focus is, the collaborative relationship between speech pathologists and applied behavior analysis, or behaviorally oriented professionals, namely BCBAs. And I am so grateful that you have that background and perspective, because I think that, I have to assume, brought a lot of information to your article, or a really unique perspective to the research that we are reviewing with our audience today.
Part of the reason I went back that far into the history is that, so when I did my graduate training, there wasn't yet a profession called behavior analysis. So, and both my program at Temple, my master's program, was an interdisciplinary program, as was my PhD program, because it was combined with special education. And so, but the courses that I took were at Temple, I took courses with psychology graduate students who were studying cognitive psychology, or they were studying social psychology, or they were studying experimental psychology, but they weren't necessarily doing it with, from a behavioral perspective. And there were a group of behavior analysts too, but the idea was, there wasn't this idea that it's all behavior analysts, and there was a real value. It was always conveyed to me that there was a real value in learning the perspectives of folks from other other theoretical perspectives, other disciplines. Like there's value in that and having that conversation. And the way you influence and the way you contribute as a behavior analyst is by being involved in those conversations and being in kind of an interdisciplinary setting. And so as the field of ABA has sort of become, as it's evolved into sort of being sort of a separate discipline, if you will, or a separate profession of behavior analysis. And I think that the BCBA has been a fantastic thing for people with autism and significant disabilities. And I fully support, credentialing a behavior analyst. But I think, I've seen over the succession of task lists and the increasing focus on additional coursework in behavior analysis. And I think that in that, some of the interdisciplinary training that I received that was valued by the folks who trained me, some of it's been lost a bit.
Mm-hmm.
And I think that we see that reflected somewhat in the kind of the practitioners of the field. Again, this is not to say that the BCBA hasn't been fantastic for people with autism. I think there's no doubt that it has, but I think something has changed in terms of, 20 years ago. I think that we were more, we were more of an interdisciplinary sort of field than we are today, probably. I mean, there's always been some isolation, but I think that there's always been islands and silos as you have in fields and different professions, but I think it's grown.
I couldn't agree more. And actually, we've reviewed some of that history with our listeners who are primarily speech pathologists as a reminder that the field is young,
Right.
And there have been changes and there continue to be changes moving forward. One of the primary reasons that we wanted to bring you on today was related to an article that you wrote in 2011. And as you know, Amy and I are both speech pathologists, and we're very passionate about collaboration. Just like you, the multidisciplinary education and treatment and how powerful and important that is for our clients. I can't speak for other fields, but the fields of speech and language pathology and applied behavior analysis have a very, very strained relationship. And even though both sides acknowledge the importance of multidisciplinary care, and both fields have statements in their ethical code about collaborating, the importance of collaborating with professionals, there's still this great rift, and it's complicated and it's old. But the article that we're here to talk about focuses on collaboration, specifically from the perspective of the BCBA and the training that's received to become a BCBA. And as you mentioned, it's changed over the years. Can you tell us what motivated you to do this research or write this article, or, what research in the field was lacking when the article was written in 2011?
Yeah, sure. So the study itself was the thesis of Amy Kelly, who was a master's degree student in applied behavior analysis at Temple. And so she had the idea to do this study because she was working in an interdisciplinary environment, and as I recall, had encountered some challenges, or maybe observed some of the challenges in interdisciplinary collaboration that you were describing, Kate, that many of us had seen. And I think that she was interested in understanding how behavioral professionals had been trained to engage in collaboration, engage in collaborative practices, and then also how they viewed collaboration in their practice. So, as with any survey research, there are certain caveats and limitations to it. I mean, we tried our best to get a good sample of behavioral professionals, including at that time a large chunk of BCBAs. Although I think at that time there were only something like 5,000 BCBAs. And I think at that time I can't recall if I think there was a BCABA certification. I'm not sure if there was an RBT certification at that point, but I'm pretty sure there are over 100,000 certified BCBAs, BCABAs, and RBTs combined. It's something like it's
exploded over the last couple of years.
It's just yeah. But so she was kind of interested. She had working in a multidisciplinary, interdisciplinary environment. She had kind of encountered some of these issues, and I think she was just interested in studying it. And I thought that was a great idea, and I encouraged it and kind of helped her put together the study. And then we thought we got some interesting results, and so we wrote it up. And I've done webinars over the years and have continued to present some of the data when I have conversations or present and talk about collaboration, because I think some of our findings are still pretty relevant.
For sure. And, I know I have already said this in this recording, but when we originally read this article, I was pumping my fists in the air with enthusiasm and excitement because
text messages.
Were you like,
I was like, yes, this is it. So one of the big findings of the article is that the participants that you surveyed reported little formal training, pre-service or in-service, in collaborative practices, based on the definition that you gave in the survey.
Right, exactly.
And that to us feels like a pretty direct contrast to the collaborative nature of the BCBA role, as BCBAs graduate from their programs and very often end up in consultative roles, which requires, based on the nature of consultative work, requires a collaborative approach. And in your discussion, you point out that there is a need for coursework at the graduate level to specifically address these collaborative skills. Do you know, in this sort of continuum of how the field has changed, if that has changed at all since this article was published?
I don't know whether or not that's changed in the last 10 years or so. And as you pointed out, the way we defined collaboration in the survey was, it was kind of a simple way, but it was also a way that would kind of gave us a good, solid operational definition. And that was, they took a course that included collaboration in the title or the description, or they took a workshop that included collaboration in the title or description. So maybe, collaboration might have been covered in a certain way within coursework or within a CEU workshop. But overall, the sentiment that the respondents expressed was that they weren't getting a lot of sort of formal collaborative work. I can't say whether it's changed. I know in my own work, currently in my own work, interdisciplinary training, pre-service professionals to engage in interdisciplinary collaboration is something I value a great deal. For example, in the spring, I'm teaching a course on academic interventions. That's really it's kind of like a behavior analysis sort of multi-tiered systems, multi-tiered interventions course, but it's going to be my class is going to be all people who are trained to be school psychologists, which I'm really excited about, including people who are not behavior analysts. So we at Temple, we've found a way to be, I think, pretty interdisciplinary in terms of integrating ABA across not just the more behaviorally oriented professions like BCBA, but also school psychology. But it's challenging, and there are definitely challenges. So like when I started at Temple, there was quite a bit of overlap between special education and ABA, like the classes and things like that. And teacher certification has kind of like ABA and teacher certification. I think this happens in all professions too. It's like teacher certification has really become more like they're just more and more and more and more requirements. And the BCBAs kind of evolved that way as well. And there's just been less room to overlap the courses. And it's more challenging to have an interdisciplinary program. So my suspicion is that I don't have any data to support it, but my suspicion is that collaboration is there probably aren't more kind of formal collaboration workshops or courses than there were. Like I said, I've been doing webinars and periodically, and and when I do them, the feedback I get is like, oh, this is great, like there should be more of this. So my suspicion is that we're probably in a similar place, which I think is too bad. It's fun when you approached me, I was like, I haven't had my head in so much in just because of the nature of the work I do. I'm very steeped in sort of what's happening in special ed and ABA and school psychology to a lesser extent, but not so much speech language pathology in the last few years. And so when you you were kind of mentioning about the it's kind of the strained relationship between some SLPs and some BCBAs, I sort of like started to, look into it a little bit. And I went to the most definitive source for, current events in anything, which is Reddit, right? So I went to like the ABA, I went to the SLP subreddit.
What did you
and I went
find?
to
Wild.
it's never it's just a rabbit hole you don't want to go down when it comes to anything, any topic. Well, Reddit's good because if you really want to like geek out on something, like I'm really into guitar, so there's like a guitar, there's a couple guitar subreddits I follow, like it's good for stuff like that. But then it can there's there's a lot of inappropriate stuff. But like, well, yeah, I mean, I found what I found when I read both, really kind of disheartened me. And I know that it probably represents the extreme of people complaining about one discipline or or the other, but
it's real.
I think that
it's real. I mean, it's a real rift on the boots on the ground. I think there's a shared scope of practice, and I think when you have a shared scope of practice combined with, to your point, a field that operates more in a silo, given the age of the field, or, has its own little island. And we've used that analogy a lot before on this podcast. I think it's hard. It makes it more and more difficult to collaborate.
Yes. Yeah. So yeah, I mean, I think, well, if it's like there have always been tensions between, some speech language pathologists and some applied behavior analysts. I mean, I think that there are differences in the way like behavior analysts approach behavior or communication as behavior. Whereas I think there are some SLPs who are like, well, communication is not behavior, and like you have to look at the intent, and the behavior analysts are like, well, it's behavior, and yeah, SLPs are like, well, it's communication's not behavior, and you have to look at the intent, and you ignore the intent, and the behavior analysts are like, yes, communication is behavior. Like, duh, haven't you read behavior? Don't you know about Skinner's verbal behavior? And I'm not saying that they're like that, that they're going duh, but like, it's like, you have to, it's communications behavior. You have to look at motivating operations, and you have to look at discriminative stimuli and stimulus control, and, schedules of reinforcement, all very important stuff. But there is that rift that I think has always been there. But now that behavior analysis, the profession has become a profession and it's grown, and it's like, well, I'm an SLP, but I can only bill for, and I don't know all the SLP, kind of service delivery issues the way I know them in behavior analysis, but it's like, I can only bill for like 60 hours. And, here's the ABA program. It's 30 hours a week, or it's 35 hours a week. And, this person is, quote, communication, but they're not really teaching it the way they're supposed to be. And I think that they're just these disciplinary, like they're these, like, just like when I worked in Nevada, and like the licensure of behavior analysis was becoming like a thing in states, and it was becoming a thing in Nevada. And we got pushback from the psychologists, because the psychologists are like, well, they're like, like the BCBAs are like, well, we change behavior. And then the psychologists are like, well, that's what we do. Like, we change behavior. Like, so,
right.
And, I think it's been worked in a lot of states, but you do have those same kinds of issues. And I think it's more complicated though, because with ABA and SLPs, because like a lot of like most BCBAs are working with children with autism and neurodevelopmental disorders, and children with autism and neurodevelopmental disorders, like what's a primary challenge associated with autism? Well, it's communication. So BCBAs work on communication. Like that's a big part. That's like a huge primary part of their programming. If you work in Kate mentioned that I think you do quite a bit of research with or in your practice you do quite a bit of work with augmentative and alternative communication. Well, that's what that's what a lot of BCBAs do. Like, and SLPs do that too. So I think you just have these professional issues that have come, that this conflict that's come about just by virtue of the fact that ABA's kind of become a profession, and there's some overlap now with SLP practice that didn't exist previously.
And I think you make such a good point about the service delivery, because, and I think that's a big contributing factor to the issue of encroachment, because the speech and language pathology funding model is one session, or if you're in a school, maybe 3 a week for a half hour or 45
Right.
minutes.
Right.
We do not have a billing structure for indirect service, which is a massive, massive, it's a problem in our field completely unrelated to the relationship with ABA. I mean, it's just a problem in general. But when you are talking about that overlap in scope of practice, and you have an individual who can bill for 40 hours a week, or how about someone else
Right.
bill for 40 hours a week? I mean, that's a really big, if you're already feeling a little territorial about, hey, this is my client, this is what we're working on, and the other individual is just by the nature of the field able to bill for so many more hours, that's a
Right.
really big, that's very out of balance. And sort of looping back to this, the point of the focus of our conversation today related to collaboration, that can be a really big rift in terms of that collaborative practice.
Yeah, and I really don't know what to. I don't have any ready-made solution or ideas to address those kinds of structural, issues about what's fundable and what's billable. But, when I look at the, again, back to like my, looking at Reddit, like when I looked at some of the concerns, I felt, I just sort of felt like there's always like the one thing that SLPs have to, like, if you're an SLP and you're working with like a BCBA, like the BCBA may not have faced like any sort of like, gotten flack from folks for being a behavior analyst or being an ABA practitioner, but that ethos, that history is very much present and is still influential in the field, and it goes way back to BF Skinner
And
and
Chomsky.
Skinner and Chomsky, and Skinner
Yep.
wrote this book called Verbal Behavior, where he kind of gave his perspective, his behavioral perspective on like what most people call language, and Chomsky kind of ripped it apart, and sort of most of the all of the field of linguistics just about, and most of the field of psychology sort of sided with Chomsky. And I think like behavior analysis has always been kind of maligned and misunderstood. And so some of the defensiveness SLPs may sense from BCBAs, like it kind of comes from that history. Even if a BCBA hasn't directly experienced that, they may have sort of learned about that history and taught, and sort of been taught to, kind of be defensive about it, or the history may have influenced the BCBA's training to the extent that they've been taught like, well, this is what's great about our approach, and we should rigorously and aggressively advocate for it. So I think you have to if you're an SLP, you have to understand that history. If you're a BCBA, I think you have to understand it. I mean, I can say this, having worked in the field for a while, like I've had lots of disagreements with, with other BCBAs and with psychologists and with SLPs and with OTs over the years, with regard to students or clients or, in practice situations. But I've not yet met a professional who didn't have the best interests of their clients and students at heart. And I think, and I think like you have to recognize that as the foundation of whatever, work you're doing together with professionals from other disciplines. And you also have to recognize and acknowledge that everybody has something to offer the interdisciplinary team. Like everybody has something to offer. Everybody has something to contribute. Like when I hear BCBs say things like, SLP is not evidence, or, speech language, pathology or
Yeah,
speech language
our
therapy is not
research is not real.
evidence-based. It's like,
I had
yeah,
a
it's like, it's not
BCBA tell me
evidence-based.
once that unless I could provide an article that was from JABA, specifically from JABA, that they wouldn't listen to my recommendations were moot. I was so
Yeah,
mad.
and it's really interesting, and it's a little ironic because ABA is regarded as being evidence-based, not because of like single subject design studies. For the most part, it's because at least with people with autism, it's because there've been these group randomized controlled trial studies that have been done, and then there've been these meta-analyses that have been done, and these studies have been largely done by people who are not behavior analysts, who've said, yeah, actually, yes, it works, but it's not necessarily just the kind of single subject like JABA studies. Not that work isn't important. That work has been a big focus of my research, And I also think like you have to really recognize that it's about like it's not whether a discipline is evidence based. It's about whether practices are evidence based. It's about whether practices and strategies and interventions are evidence based. It's not like SPs aren't walking there's not like such thing as an evidence based SLP or an evidence based BCBA. Right. It's about evidence based practices. And I mean, people have been teaching other people to do things in thousands of years of human history before the BCBA, before SLPs came along, before BCBAs came along. And so somebody can effectively teach something without necessarily knowing or being fluent in principles of behavior or ABA techniques. That's not to say that ABA techniques aren't great, and oftentimes they're the best way to teach something. But you can be an effective practitioner and not, call yourself a radical behaviorist. And I think that point, that point gets lost a little bit in these discussions about like, well, you have to be a BCBA for teaching communication, or you have to know ABA for teaching communication. It's certainly helpful. Like when I came across this book a few years ago called Behavioral Principles in Communication Disorders. Are you familiar with this one?
No,
but I'm
I'm ashamed about this book. Yeah.
It's by Christine Mall, Brooke Finley, and Amanda Nicholson Adams. And I don't know them at all. But it's like Christine is an SLP, Brooke is a BCBA SLP, and then Amanda is a BCBA, and it's all about like principles of behavior. It's basically an ABA textbook for practitioners, including SLPs who are teaching communication or addressing challenging behavior. And so that's an example when and I actually use chapters from this book in my undergraduate course on ABA and autism. Not a course for SLPs, although some people who want to be SLPs have taken that course, and it's great. But it's an example of a collaboration. In my opinion, one of the greatest collaborations in the history of either field is with the picture exchange communication system. Yep. Andy Bondi, behavioral psychologist, Lori Frost, speech language pathologist. And if you look at PECs, and you understand how the implementation works, you can see the influences from both from the behavioral perspective with Skinner's, analysis of verbal behavior in there, and also from the SLP perspective. And I think that's truly what interdisciplinary collaboration is. It's not just like, professionals work, kind of who are assigned different roles on an interdisciplinary team, and one person working on communication and the other person working on challenging behavior or whatever. It's that combination of expertise that really is what brings benefit to consumers.
And not to sort of bring it back to your article, but I think that's why I loved this article so much, is because it highlighted, and one of the things that you say in this article is that there was this concept of a unidirectional process. So right. Multidisciplinary treatment is not a unidisciplinary process. And yet so many of the participants, the behaviorally oriented professionals that you sampled, felt as though, it wasn't that they felt as though, but the data indicated that it was a unidirectional process, that they were likely to make recommendations to others, but not likely to adapt recommendations from others unless they were a BCBA. And while that sounds really terrible, and I mean, hey, I'm a BCBA. I know a million BCBAs that I love that are incredible. While that sounds very negative, what resonated with me, and I think what will resonate with a lot of our listeners, is that it was representative of a lot of those conflicts that I have had, where I'm told I can't do a treatment unless it's behavioral oriented. I was told once, well, you do communication and AAC, I do behavior, so we don't really have anything to talk about.
Right.
I've been told, the JABA thing, I've been told all kinds of nonsense. And yet here I am still operating with both hats on, because I do see that there's this great benefit of multidisciplinary work. And yet there is this there's this habit or flavor or culture of unidirectional collaboration. Amy, what are you thinking?
I was just going to kind of show the flip side of that though, because I've had a number of really positive collaborative experiences also with BCBAs.
Totally.
And so I think that there are specific skills, and some of those you mentioned in the article, Dr. Giancani, but there are specific things that we can do to be more effective collaborators. So I think that while there is a real rift, there are legitimate challenges that arise. And I think there are structural things that are in place that are sort of facilitating some of these problems, unfortunately. There are also skills. We don't necessarily get fantastic training in being interdisciplinary collaborators either. Special educators don't necessarily get a lot of extensive training about the specific skills that you need to be an effective collaborator with other disciplines. And so I think for all of us, there's also a space for professional development there. And I didn't know if you want to talk to us just a little bit about some of those pieces, like the idea about, what is a collaborative directive approach? What are some of the things that we could be doing, to expand our skills too? Because chances are, there are definitely tough times, and sometimes you work with somebody and they're just tough. But for the most part, if it's not working, there's probably things that both participants or all participants are doing to not facilitate that process.
Just for the record, this is the part in the article where my hands were pumping in the air with this idea of the collaborative directive approach. I would love to hear more about that. I think everything Amy said times 1,000.
Yeah, I can't really speak to. I'm not by any means an expert on the collaborative directive approach. I think that we kind of included that in the discussion of the article, to sort of describe maybe one way that BCBAs or behavioral professionals could be more collaborative with professionals from other disciplines. To go back to the finding from the study about the behavioral professionals reporting that they were more likely to provide a recommendation than accept a recommendation, I think that it's hard to tease out the way we conducted the study. The data don't really let us tease out why that was the case, because it was just a survey. It could be, I think in some cases, it probably does speak to what you were describing with the fact that BCBAs maybe aren't recognizing the value in the recommendations that an OT might make or that an SLP might make in their behavioral programming. Some of it might also speak to the fact that BCBAs are making recommendations about very specific areas that don't necessarily overlap with those disciplines. Like you said, a BCBA might be addressing challenging behavior, but not addressing, other kinds of targets that might, fall in the domains of those other professions. Or a BCBA might be called in to consult with a special education teacher, where it's this kind of situation where there's this expectation that the BCBA is assessing behavior and then basically telling the teacher what to do. And I don't believe that's a good model of consultation at all. You certainly have to recognize, you've got to listen to the, even if you're called into a situation where a kid is engaging in some significant challenging behavior, you've been asked to do an FBA, you still need to get buy-in from the teacher, whomever is going to be implementing the intervention. You still need to get information from them, not only about the what's happening with the behavior, but also about what they can realistically implement as a behavior intervention in the classroom. It's not just this process of I do an FBA, I write the best behavior intervention plan I can, and then I just kind of hand it off, and then if it doesn't if it doesn't work, then it's just it's their it's their fault, it's on them, which I think is oftentimes what we see. But to go back to what sort of makes effective collaboration. I think that as I was saying earlier, everybody has to recognize that the professionals at the table have the best interests of the client or the student at heart. I've just never seen anything different than that. And when, you get into these turf wars, and it kind of reflects the general overall discourse of the way things are going in our country these days. It's when one party views the other party as an existential threat, there can be no, there's no resolution at that point. It's all just people arguing over, arguing over each other. And so sad and disheartening. But I think if you say, put that aside, you have to kind of put the professional turf, whatever, encroachment issues aside, and recognize that everybody, like no one got into wanted to be a BCBA so that they could just dominate and control other people, or no one got into, no one became an SLP because they wanted to give BCBAs a hard time. It just doesn't work. We've got into these professions because we want to help. We want to fundamentally help people. So I also think learn something about the other professionals' discipline by actually reading something that somebody from their discipline wrote.
Yes.
And I don't know.
Agreement.
I don't know what that would because what happens is like we were talking earlier about Chomsky trashed verbal behavior, but then everybody just read Chomsky's review and said, well, this stinks, and no one actually read verbal behavior. I can't really speak to the SLP side of that, what BCBA should read. Maybe you, Amy, and Kate can recommend something, or you can think about it and recommend a reading to the SLP folks who are listening. But read, if you're not familiar with behavior analysis, read Skinner's book, Beyond Freedom and Dignity, and you will definitely get a very different impression of behavior analysis than maybe you thought. Reading a job article, if you don't know about, if you don't have a background in behavior analysis or single case design, that could be pretty steep. But yeah, read something read one of Skinner's books. Even if you're BCBA, please read one of Skinner's books. And you'll learn something, read about behaviorism, read Science and Human Behavior, but read something actually written by somebody who is from the discipline or profession, because I know the ABA perspective so much better because that's my background and training. Because it's I read things that people are writing about, some of the things I can tell you I have, last year, in the last year or two, I published an article with a colleague, Jason Travers, who's now at Temple with me, about publication bias in behavior analysis and behavior analysis research. And the thrust of the article was that publication bias has been widely recognized as a problem in the social and behavioral sciences. It's like a thing. It's been documented. And publication bias is when studies usually manifests when studies that have good, strong experimental control or big, strong effects are more likely to get published. And our paper was just basically arguing that maybe this could be a problem in behavior analysis too. And after it was published, I got an email from the journal, from the editor of the journal, and he was like, "Hey, your article's got all these tweets, it was this crazy, he's like, yeah, the publisher was like, this is awesome, his article has all these tweets, because they like that because it helps the publisher sell articles." And I was like, oh wow, okay. So I started looking at the tweets, and the tweets were mostly from people who were really adamant critics of ABA, who were saying who just read the title and the abstract of the article. A lot of them were the kind of the neurodiversity, people who are see, these are people from the field of ABA, and they're saying that ABA is evil. It was literally that level of see, this is proof that they're harming, that they're harming children and they're hiding it. If when we're at that level of discourse, it's just never take the time to please, whoever, if anybody is, of the
tweeters,
100,000 possible people who read those tweets, please take the time to read the article, because we're not saying that ABA is, we're not confessing that we've, been harming people all these years. We're merely saying that this problem that's been well documented in other areas of science might be happening here as well. So anyway, I know you want to.
You bring up 2 points that I just want to touch on, since our audience is primarily SLPs, related to the read something from the other field. There is an article that was published in the speech pathology literature that specifically recommends doing this.
Right.
And we have that listed on the show notes for this episode. So you hit the nail on the head. That's part of our practice. I'm an example of it, and I've said this on our show before, that I was so frustrated with behavior analysis from these frustrating conversations that I was motivated to go to BCBA school to infiltrate the enemy camp and dismantle it from the inside. That was my motivation, because I was like, what the hell do these people know that I don't know? What am I missing? There's got to be something I'm missing. And I went through the training and was like, oh, wait, this is awesome. This is such great science. How did I not know about this? All I knew was the stuff that I don't tweet, but all I knew was the misinformation that's out there. And I do think that is a huge problem. And we're actually going to, at some point, maybe tackle that in a whole episode, because the misinformation is a real issue here. But the other thing you bring up that I think is very specific to the field of speech and language pathology is the single case study design. So the field of our evidence-based practice model through ASHA is comprised of both, used to be client perspectives, external evidence, and the third one. What's the third one? It's completely escaping me.
Yeah, so that's like
Clinical
kind
evidence.
It was client perspectives, clinical judgment, and external evidence. And recently,
yeah, and by the way,
that
that sort of three-pronged approach to evidence-based practice is one that's been adopted across. So SLP is not alone there.
Right, but ASHA changed it. I don't know what other disciplines do, but ASHA changed it recently to include internal evidence. Right. So part of our evidence-based practice now is comprised of not only external evidence, but what they call internal evidence, which is basically
your client's data. Right.
So taking data on the effectiveness of your treatment with the client to, not single subject design in the true research sense of ABA and functional analysis and all that, but the concept of seeing your client as a lovely experiment of one, and taking data to test your treatment as an independent variable. And that is now part of our evidence. And I think that is one thing, if a speech pathologist is listening and does want to read more about the field of behavior analysis in this exercise that you're proposing of reaching across the aisle and learning, that is something that is really applicable to what we do, as our governing body has has outlined for us. So I think that there are definitely things to be learned. And that is one of them specifically.
Yeah, I think that's really great. I really like the whole idea of like external empirical evidence versus internal. That is like at the level of the client. And there are SLP researchers out there who do single case design research like that. That exists. So there probably are some folks out there that viewers could listeners could connect with their work. That's great.
I don't think is there anything else that we want to cover? It's so incredibly thorough. I know that we had prepared questions for you, but then this conversation was just so engaging. Are there any other things that we want to add before we wrap up?
I think I hit everything that I wanted to talk about. Yeah, nope. We're good on my end.
Okay, that's great. Well, we really appreciate you hanging with us.
This was great.
And, all of our listeners out there, we had some technical issues. Matt was incredibly gracious and patient with us through our technical issues. So
part of the problem was, can I tell my jokes now?
You can totally tell your jokes now.
I don't really have any jokes. I just thought it'd be fun. Like, because Kate and Amy were like, "Oh, we try to keep it, we just try to keep it light and try to keep it real." They didn't really say that, but like they were like, and I was like, "Oh, I have some I've prepared some jokes."
We're happy to bring you back for a set.
And they were like, sure. They were like, "Oh, sure, yeah, you
can
tell your jokes, weird guy who we just met." No, I don't really. I don't know.
No jokes. Okay. Well, we really appreciate you participating, and this was super informative. And I'm sure everybody listening is going to take away many gems of knowledge. So.
Yes.
Yeah. And to anybody who's out there, please feel free, if you want to, there's an article or you just want to chat or you have a question or anything, bounce some ideas off of me. Please email me. I'm sure that Amy and Kate can put my email address out there.
Absolutely can.
Thank you so much.
Yeah.
Thank you again so much.